Hi, my name is Dr. Ashley McClure in the San Francisco Bay Area, and I'm going to do a little explainer about the Dear Patients Open Letter, which is a letter from physicians, nurses, medical students, and nurses and mid-levels across the whole country. And we're writing this letter discussing the health harms of climate change and asking our patients / America's voters to choose leaders who will act on climate in order to protect health. These logos that you see here are the organizations that are in the coalition that is helping to kind of build this campaign and this project about the letter. So this is a picture of me holding a sign saying that climate change is the most powerful social determinant of health and that climate policies are health policies, and this is part of the reason why I'm a part of this effort. The other reason is this adorable little baby girl in the middle. She's my daughter, Cala Lucia, and she's my reason for climate advocacy as a physician, and also because of the spirit of solidarity and understanding that and if we don't have a safe and healthy planet, none of us are going to be able to be safe or healthy. So the inspiration for the Dear Patients open letter came from a letter from 11,000 scientists that was published November of last year. And they very clearly said that if we don't address the climate crisis, there will be untold suffering, and it got a lot of press. So the letter that we're asking you to co-sign and hopefully share with your networks is an open letter, like I said, to the American public / our patients, asking for their help in addressing the climate health crisis by choosing climate-solving leaders who prioritize health and safety. Our letter strategy is, this is all a very grassroots effort, and we're sharing it one physician, medical student, nurse, etc., with our own network. So currently, we have 2,400 signatures from medical providers across the country. We need to get, our goal is 11,000 signatures, but at least over 10,000 in order to attract the level of media attention that we need. And our goal is to get the letter published with commentary about why all these nurses and doctors and medical students and nursing students took the time to co-sign this. So we're trying to get this, a story about the letter published in a national centrist media outlet mid-October as people are voting, so that they have it close to heart that the trusted voices in our communities are recommending that they choose climate leaders in order to protect the health of their families and themselves. So we all know that our strength is in our community, and this, like I said, is a completely grassroots effort. So to achieve our 11,000 co-signers goal by next week, we're going to have to not flatten the curve, but surge the curve, which is just through kind of the different networks that we all have. So the way that we're asking you to help us do that is to, right now, take a few minutes, and the idea is to kind of walk through our own individual networks and think about who we could share this letter with. So some ideas could be, who are your 5 closest physician, nurse, medical, nursing student friends at work or at school or in your family that you might share this with? Are there a few health listservs or Google groups that you get messages from a lot that you're a part of that you could share this letter with? If you're practicing right now, who is your department's chief? Or if you're in school, who's the dean of your school? And could you ask them to send the letter as a team building opportunity? If you're done with training, where did you go to medical school, or where did you do residency? Where did you go to nursing school? And could you ask the letter to be shared with current students or house staff as an alumni favor? And then if you're part of any local or specialty professional organizations, you could hopefully ask that they include the letter in an upcoming newsletter, the sooner the better, or if they could send it out individually as an action alert. So these are just some ideas to kind of activate your personal networks. to help get the word out. And we are here to help. So we have templates for all of those outreach kind of spheres. So at the end of the letter itself, this arrow shows that the last question is a link to a Google document that has various different templates that you can use to reach out to colleagues by email or to organizations by email. And then we also, in that same toolkit, which this is QR code for it, so you can actually take a picture and it should take you to the toolkit. There's also social media posts that you can just copy and paste into Facebook or LinkedIn or Twitter and post them there to get visibility in a different way to help us to gather the 11,000 signatures that we are shooting for. And then where we're headed is once the letter and a story about the letter has been published in hopefully a national centrist paper, we're hoping that you might help us to share it out and kind of amplify the story about it. And then we also have some templates that we'll offer later to write op-eds in your local papers, again, about the letter. And this is an example of the op-ed templates that we have. So you could just customize it for your own voice, make it sound like yours, and then submit it. So that's it. A big thank you from the Dear Patients Open Letter Coalition that you are a key member of. And if you have any questions, feel free to email at caclimatehealthnow@gmail.com. And we really appreciate your time and help. Thank you.